want to see a difference, do like bench or upper body on Monday, and then you wouldn't do it the next day, but do bench the next day, but breathe molecular hydrogen for 30 minutes before you do that same exact workout, and prepare to be amazed at how you're able to do it like you did not just work out the day before.
That's amazing. That's awesome.
Great. Brother, this is unbelievable. Unbelievable.
All right, we're back here. I'm Dr. Roddy. Welcome to another episode of SiblingRx.
And I'm Dr. Yas.
We're really excited today. We have some really great content, and we have our first guest on our show, which has been something we've been working on, aligning some really great people in the field of longevity and all this stuff that people don't know about, that people need to know about. So
that's a good look you have going today.
Yeah, we'll talk about what's happening here in a few minutes. So we've got a couple guests on today. You want to do the intro of them?
So we've got Hydro Heal on here. They are the CEO and the medical director. We've got Mick, Emandi, and Dr. Greg Carter here that are joining us, and they're going to talk about all things molecular hydrogen, their machine, the Hydro Heal, and how it can benefit you, how it works, how it benefits your health, and all those good things.
Yeah. So guys, we want to kind of let you guys start out and talk to us a little about Hydro Heal, what the background of your company, and then we'll get into the science of molecular hydrogen, and we've got some questions for you, and that way our listeners can understand the importance of hydrogen and the things that you guys have seen with your many physicians that utilize this either in their clinics or people at home in the form of this type of biohacking or in the realm of longevity. So we'll let you guys take it away.
Yeah, thank you. My name is Mick, and I've been in healthcare for over 35 years, practically done everything in healthcare. Over the last 9 years, I've developed a practice in Florida. We have about 40 locations covering the entire state. And, we see a lot of patients that have cancer and brain diseases. And I came across this technology that was being introduced to America from Japan over 2.5 years ago. And initially, a friend introduced me to it, and I didn't believe him until I tried it myself. And when I had an amazing experience with it, I saw all the clinical studies, over 3,000 clinical studies supporting how molecular hydrogen is able to help with so many different conditions, from pain to, cancer to, autoimmune conditions. I bought the company. And since that time, initially for the first almost year, I was primarily having our own patients that were terminal with cancer and brain diseases to utilize the technology to help them when there was no other hope or options. And they've all done extremely well. And many of them got into remission, and many of them have improved significantly. They're having functional, productive lives. And since that time, in the last year and a half, been focusing more on trying to get as many other providers engaged and knowledgeable about the technology and how it can have an immediate therapeutic effect on their patients, so we can help as many people as possible.
That's great. Dr. G, could you give us a background about what molecular hydrogen is and how it can actually help a person's health?
Yes. Thank you very much for having us on, by the way. I think that molecular hydrogen is a super fascinating medicinal gas. It wasn't even discovered until 2007 at the University of Osaka, Japan, where the team at Osaka was trying to identify medicinal gases that could supplement their hyperbaric oxygen therapy for patients who had the bends. One of the scientists postulated that based on the chemistry, that molecular hydrogen should be a great adjunct to it. They set out to study it in 2010. Their first paper was published in Nature magazine, the premier scientific journal, for these types of data. And since 2010, over 3,000 clinical studies have been done illustrating the physiologic benefits of molecular hydrogen. Now, what's fascinating about molecular hydrogen is it is germane to so many functions in the body. And just the top two kind of tiers are, on the one hand, molecular hydrogen is a selective antioxidant, meaning that it will specifically locate, close with, and target only the two most harmful free radicals in the body, the hydroxyl radical and the peroxynitrate radical. And the reason that that's important is if you went to school in the dark ages of the 20th century, like I did, when your search engine was the yellow pages, we were told back in the 80s that all reactive oxygen species are the devil. Therefore, we must go to Vitamin Shop and we must stare at a wall of confusing colored antioxidants, buy as many as we can, carpet bomb the body, and hope that something actually happens. Well, when we decode the human genome in 1998, we discovered that actually a lot of these reactive oxygen species are necessary for intracellular communication. And so broad spectrum and wanton distribution of antioxidants can actually have a negative or deleterious side effect. But these two free radicals, hydroxyl and peroxynitrate, it was found are responsible for over 90% of the inflammatory responses leading from reactive oxygen species in the body. And so because molecular hydrogen will selectively target only those two, it allows the reactive oxygen species necessary for appropriate cellular communication to just remain free, okay? In addition to that, the NRF2 pathway, which is the body's main detoxification pathway, is held under a lock and key called KEEP1, a KEEP1 enzyme. As it turns out, the key to unlock the KEEP1 lock on nuclear factor 2 is in fact molecular hydrogen. Who'd have thought? On the other hand of the molecular hydrogen spectrum is it is responsible for energy metabolism, in that a lot of the disease states that we're facing in the 21st century are that our bodies are not able to metabolize the nutrients that we're getting and turn them into utilizable energy for people that we call ATP, right? And so what it turns out is I gave a talk at A4M a couple years ago, and I said, hey, if these little space aliens with their own DNA, mitochondria, the engines of the cells, are taking sugar and oxygen and fat, they're turning into human fuel, they're turning into people fuel, ATP. Show of hands, anybody know what is the fuel source for these little engines in our cells, of which we have 100 to 1,000 in each cell? And it was crickets. And I said, don't feel bad. None of us have looked at the Krebs cycle since 7th grade. As it turns out, the fuel source for the mitochondria that is creating the energy for you and me in every cell and every system in our body is molecular hydrogen.
Yeah, that's interesting. And that is really good info. I just want to kind of summarize a couple of things, because I did, in preparation for our call today, I was doing a little bit of research on molecular hydrogen. And just for some of our listeners that may not be in the medical field or know what, even what a free radical is, so free radicals are naturally those things that we try to eliminate in our bodies. But what Doc's saying, and certainly extremely valid and accurate, is the fact that there are some free radicals that our body in essence does need to keep our immune system functioning and whatnot. And yes, you're absolutely right. And it wasn't very long ago where the main goal, even when early on in practice for us 25 years ago, we would always try to promote our patients, get as much antioxidants in your body as possible. You gotta kill every free radical in your body that you can. And it's interesting to learn as science has evolved and the unveiling of the significance of molecular hydrogen, that there's actually some free radicals you do need. It's like the bacteria, right? It's like the bacteria your body needs to keep your immune system at a high level. But the selective antioxidant that you said, Dr. G, is such a key factor to molecular hydrogen, because the hydrogen is able to specifically target the free radicals that it needs to target, versus taking something orally. Who knows where it goes? It's really all over the place. So I appreciate you sharing that, because I think that's such a significant factor, and that a lot of people just need to know. This information's out there, and that's why we're very grateful for you guys to come on, because we're trying to get this to the minds of as many people as possible, because it's not difficult. As you can see, as we're here talking to you guys, we're under therapy. We're doing it. It doesn't take a lot of time. But you're not really
inhaling.
I'm inhaling. I'm holding my breath the whole time as I'm talking. No, but yeah, it's really a very simple way of doing it. So.
Yeah, absolutely. So would you say that this therapy ultimately improves your mitochondrial function?
There is no question, to answer your question, doctor, that molecular hydrogen improves mitochondria along the following gradients. You know, if for those who don't know what a mitochondria looks like, just imagine a little tiny subcellular kidney bean, right? And inside of it is a folded up napkin called cardiolipin. And then, you know, oxygen and sugar and fat go in one end. It goes through the little engine, and out the other end comes human gasoline called ATP, right? Through this magic trick called oxidative phosphorylation. Okay, well, what happens is as we age and we expose ourselves to the convenience of the 21st century, like Doritos, Mountain Dew, Wi-Fi, calcium in the water, name your poison,
Glyphosate, yep.
shells of that kidney bean, the shells of that mitochondria start to crack, they start to degrade. Now, what's being pushed along that electron transport chain is in fact electrons. Okay, electrons are the electricity, the power that's creating the ATP. And if the sides of the kidney bean start to crack and fray, the electrons leak out, as you would expect. And so the more electron leakage there is, the less efficient that the electron transport chain is. Molecular hydrogen bonds with the exterior membrane of the mitochondria, in essence acting like a de facto biological, bondo or spackle, so that the electron leakage is significantly diminished and the electron transport chain is then enhanced because fewer electrons are leaking out, number one. Number two, inside the mitochondria is this folded up napkin called cardiolipin, and it is along the folds of this napkin that the electrons are jumping, right? And as we age, the folds of that, they're real tight junctures when we're young, children, teenagers, young adults. But as we age, the folds of that napkin kind of fray apart. And now the electron, instead of going from node to node, it's like Evel Knievel jumping across the Grand Canyon, right? So molecular hydrogen actually tightens up the cardiolipin junctions, enhancing the electron transport chain that way. So on three paths, one, molecular hydrogen is acting as a fuel source for the mitochondria. It is acting as a repair service for the exterior membrane of the mitochondria, and is acting as an internal engine tune-up for the cardiolipin of the mitochondria. So along these three major gradients, the mitochondria is just getting this awesome Jiffy Lube tune-up that it wouldn't get any other way without exposure to significant amounts of molecular hydrogen. Does that answer your question?
Yeah.
Yeah.
That's pretty cool. Hey, Mick, I got a question for you. Where do you see this? You're on the innovative side of this. So hydrogen therapy fitting into mainstream healthcare over the next 5 to 10 years. Like, where do you see this going? And are there competitors? Are there competitors in your field?
The popularity of hydrogen water really blew up in the last year. Now you have hydrogen water tablets, where you drop it into water and it turns into hydrogen water. They're nice and good. They have some wellness benefits. The challenge is that due to physics, the water only holds a minuscule amount of hydrogen. At maximum saturation, you're only able to have about 0.8 milligrams of actual hydrogen in 16-ounce bottle of hydrogen water. When you breathe in that machine that you have there with you, in just 15 minutes, you're breathing in 800 milligrams of hydrogen. So if you divide 800 by 0.8, you'll get to a number of about 1,000. And that 1,000 represents 1,000 16-ounce bottles of hydrogen water, equating to what you're just breathing in just 15 minutes.
Wow.
15 minutes, you're getting as much antioxidants as eating 1,000 blueberries with that Hydro Heal device.
Yeah, that's amazing.
That usually makes people understand what the potential it has for actually slowing, stopping, and reversing metabolic and disease conditions.
So going back to the science of it, can you tell us a little bit about how this improves mitophagy and senescent cells and the clearance of senescent cells?
Yeah, absolutely. Dr. Greg can maybe dive into a little bit deeper, but essentially, the mitochondria is the key, right? And facilitating more rapid cellular activity facilitates mitogenesis and cytogenesis, and mitophagy and autophagy. But I'll have Dr. Greg go into a little bit more deeper.
Yeah, Dr. Greg, can you kind of explain what those terms mean, just so for listeners that don't know? Dr. Yas sometimes likes to throw some really big words to make herself feel smart, and a lot of people don't know what they are, and I don't think she even knows what they mean. So if you can kind of shed
I
some
know
light
what
on this.
senescent cells
All
are.
right.
Thank
You can't even spell it, so.
The body is engaged in an exercise of maximum efficiency and optimum utilization of products and byproducts. And so fundamentally, autophagy for the cells and mitophagy for the mitochondria within the cells is simply that the body recognizes that either the cell or the mitochondria has passed the point of no return for repair, restoration, and optimization. It's too far gone. We're not going to be able to save it, okay? And so what it does is it rips the cell apart, or it rips the mitochondria apart, and then it turns it into its constituent parts, and then like a Pac-Man, waka 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 waka, it takes those parts and it chews them up and spits them out the other end into new mitochondria or into new cells. Okay, so your body is engaged in this, not only cycling external resources, but searching through the body for internal resources by repurposing old parts, tearing them apart, spraying some WD-40 on them, giving them a nice buff and putting them back together. It's basically what autophagy and mitophagy is. The problem is our bodies only have so much energy in the day. And what is that energy? ATP. And where does that energy come from? Mitochondria. Where do the mitochondria get it from? Oxygen and sugar. And how does the mitochondria use that oxygen and sugar? With the fuel source it gets. And what is that fuel source? Hydrogen, right? So if you just trace it all the way back, the more efficient and the more effective the little engine is, the more efficient and effective the mitochondria can create energy for more specific purposes in the body. So if you think of like prioritization of what's important for us to stay alive right at this minute, if it's an onion, right, the body is going to go with what is most important right now. And if it doesn't have enough energy to get down to the autophagy, mitophagy, it's not going to do it. So by supplying the mitochondria, by upgrading the mitochondria, by repairing, restoring, and optimizing them, and then that is the epigenetic, that just means the signal. Epigenetic just means signal to the DNA to do something. That's the epigenetic signal telling the body, hey, let's engage in not just mitophagy, but let's engage in mitogenesis, right? So as we age, we start losing these mitochondria, okay? Like I'm 60, I probably got like 30% of my mitochondria left from when I was in my 20s, And if I can get a signal from nature, hydrogen, that says to my body, hey, this guy's still relevant. These guys are going to go out and hunt a woolly mammoth tomorrow. We need to create more of these engines. Let's get on that ball and start making more mitochondria, right? That's mitogenesis. Well, where are we going to get the resources, sir? Well, there's a whole bunch of old mitochondria over here. How about we just tear them down and rebuild them better, stronger, faster? Steve Austin's $6 Million Man style. Does that make sense?
Yeah, definitely makes sense. Can you kind of explain too, because I know several years ago, maybe a decade now, you start seeing these oxygen bars all over in airports and hotels. Can you tell our listeners and people that are watching, what's the difference between oxygen and hydrogen when it comes to this type of setting?
Yeah, so, oxygen is a medicinal gas. Nitrous oxide in the dentist's office is a medicinal gas. Oxygen in the hospital is a medicinal gas. Molecular hydrogen is a medicinal gas. Each medicinal gas has a specific set of physiologic functionality in the body. Apparently, nitrous oxide is there to give you a good pump in the gym and to make you laugh a lot when you're in the dentist's office, okay? Oxygen is required for most metabolic processes. Molecular hydrogen is required for all the things that I mentioned earlier, like repair and restoration of mitochondria and optimal energy output.
Yeah, that's great. Yeah, I mean, definitely two different roles completely. I like to kind of move to conditions, things that you guys have seen from either your the people that have utilized this in their clinics or in their homes. Obviously, the biggest stem for a lot of most disease is inflammation. Can we touch on inflammation and some of the conditions that you guys have seen with your clients, patients, that people have benefited from? I know we talked about congestive heart failure and different things like that, but autoimmune conditions, I'm just thinking about chronic conditions that maybe some of our listeners are suffering from. And then, of course, on a preventative side as well.
Go ahead, Mick.
Hydrogen has been documented to be able to help with over 175 different disease models. We have patients, as I said in the beginning, initially, because the elaborate or comprehensive clinical studies on just cancer and brain diseases like Alzheimer's, Parkinson's, dementia, I use that for my own practice. Gotten amazing results for those patients and still continue to do that. We have some new technology that even accelerates that now, but hydrogen is the foundational component to stop the oxidative stress, the inflammation, and then allow the body to heal by regenerating mitochondria and cells throughout the body. Now, we also have many, many patients with autoimmune conditions, patients that have Lyme disease, mold, patients that are dealing with congestive heart failure, people with COPD, people with other respiratory conditions like even pulmonary fibrosis, asthma. We have patients that, have stroke. They respond amazingly well, especially when you do the treatment very close to the event. Basically, it helps reverse that ischemic reperfusion injury from the stroke. We have patients that have traumatic brain injury that respond amazingly well. And maybe Dr. Greg can add to that, but we even have patients with kidney failure that have had significant improvement in their condition. Dr. Greg, I don't know if I took all your steam out of that question, but
I think that the best way to think about this as a provider or even as a patient is every single disease state in the body is a breakdown of a system in the body, and that system is made up of cells, and the cells are breaking down because of an inability to metabolize energy. And that inability to metabolize energy is an inefficient mitochondrial system. And so the reason that there's over 3,000 studies, and you can Google practically any modern disease state that we have, I'll have Mick tell you how to do that in a minute, and it shows clinical data supporting the utilization of molecular hydrogen for it, is because the more energy that the human being has to repair, restore, and optimize a system, whether it's the cardiovascular system, or whether it's a broken bone, or whether it's a stroke, Alzheimer's, dementia, whatever it is, by supplying that set of cells and that group of cells, the system, with the energy necessary to repair, restore, and optimize the cells, and by extension, the system, then that is why you get this broad spectrum beneficial effect from inhaling molecular hydrogen. And I do want to emphasize inhalation because, yes, lots of studies around the drinking of molecular hydrogen water, and the studies are great, but as Mick mentioned earlier, each vessel of water can only hold so many parts per million of hydrogen. So whether it's a shot glass or a jacuzzi tub, okay, you can only have so much hydrogen, a finite amount of hydrogen in there. And in the 16-ounce glass of hydrogen versus 15 minutes of inhalation, you're getting 100x more. No, I'm sorry, 1,000x more molecular hydrogen. The magic is not a molecule hydrogen. The magic is the dose, the concentration, and the frequency of exposure to molecular hydrogen systemically for appropriate addressing of whatever XYZ problem is that you're facing.
We have many different modalities, and we're doing things in our protocol that nobody else in the country is doing, in that we have the ability to inhale it, which we are doing right now. We also have the ability to make hydrogen water. Within 60 seconds, you can turn a 16-ounce bottle of regular drinking water into hydrogen water in just 60 seconds. And by combining just those two modalities alone, for a majority of our patients, we're getting significantly faster, better, stronger results than just doing inhalation alone. And because you're hitting it from different directions, you're all familiar with the gut-brain axis, right? So if you're able to get into the brain tissue with the inhalation and the headphones, which I'll talk about in a moment, and also supplemented with hydrogen water, that significantly improves the synergistic effects of the hydrogen through the gut and through your bloodstream to all the 36 trillion cells in your body from your head to your toe. As Dr. Greg was talking about earlier, to fact check us on everything that I just said about all the conditions, you can take any and all of those conditions that I mentioned, even cancer. You can take, say, lung cancer or glioblastoma, type in molecular hydrogen in Google and that particular type of cancer, and all of the AI will pop up showing the clinical efficacy and the clinical studies underneath them as to how it works and why it works, and the clinical studies supporting what it has done for the participants in those studies.
Yeah, that's amazing.
Tons of data available, and we're just providing a device that has a lifetime warranty and will never let you down. Medical grade device, and we'll always make sure that you have the kind of therapy that you need to get the results that you want.
So walk us through your machine and give us kind of like the basic features that this has. And I know when I received the machine, we got some headphones and we got goggles as well.
The thing to make the water too.
And the water probe. So walk us through the machine, how obviously you can see how we're using it, but how simple the setup is and just basically getting it started too.
Yeah, I mean, you have that phrase sometimes, just add water, right? That's basically what it is. Just adding water is all it takes to, adding water and plugging it in is all it takes to get the machine turned on. And then from there, you're basically able to use the inhalation, the breathing, and the diffusion rod to make hydrogen water. So in just 60 seconds, you can turn any glass of water, a bottle of water, into hydrogen water. And we also have the headphones, which push the hydrogen gas, and you can do two different modalities at the same time, which is amazing. And so you're able to breathe in the hydrogen gas, and then you're able to have the headphones over your ears. It pushes the hydrogen gas through the ear canal into the brain tissue. The first thing that it does when it goes into the ear canal, it's able to help regenerate the cells of the cochlea and the tympanic membrane. And people with things like tinnitus or hearing loss, it's amazing. Tinnitus, in just a matter of a few weeks, 99% of patients improve their the ringing in their ears. And with hearing loss, it takes about 3 to 4 months, but they'll see significant improvement in hearing loss also. And then the hydrogen goes on further into the brain tissue. It helps melt away that amyloid plaque buildup on elderly patients and helps suppress the inflammation throughout the brain tissue. And then going back to mitogenesis and cytogenesis, it's helping create new neuronal cells and new tissue in the brain over a longer period of use, typically 3 to 4 months. And so it has all those benefits. We also have goggles, which also connect to the device. So you can literally do two different delivery mechanisms at the same time. So you can do the goggles while you're doing inhalation, or headphones while you're doing inhalation. The goggles put it's like ski goggles. It pushes a seal around your ocular tissue and pushes the hydrogen gas against your eyes and helps regenerate the tissue of your cornea and your retina. And so for patients who have vision loss, macular degeneration, glaucoma, cataracts, it helps with all of those conditions. If you just go to Google and type in molecular hydrogen and say glaucoma, you'll see what I'm talking about. So it's all right there in Google. So if anybody wants to understand the mechanism of action, it does that. Because our machine does multiple modalities at the same time, and it's such a, very high volume of hydrogen molecules that you're receiving, you're able to get much faster, better, stronger results than any of the clinical studies that exist.
Yeah. I was going to say, there just doesn't seem like there's a condition that it couldn't benefit from.
Right, because it improves your mitochondria.
For all conditions, right, which is cellular dysfunction. You fix the cell, you fix the condition, right? People with diabetes, that's a metabolic condition. If you just type in molecular hydrogen and diabetes, it'll blow your mind, just like that. Any and every single condition is right there on Google.
When you put the nasal cannulas on, you don't really feel air. It's not like you're feeling when you put an oxygen thing in.
You don't really feel
But
much.
when you put it in water, you can see it's bubbling, so there's stuff coming out, right?
Yep.
So that's the hydrogen coming out.
That's what a lot of people maybe have a comment about when they first try it, because a lot of people are used to using oxygen machines where it's like a breeze that's coming into your nose or your mouth, right? Well, the air around us is 21% oxygen. So these oxygen concentrators, all they're doing is taking the air around us and pushing it through a very tiny tube into your nose. So it feels like a hurricane sometimes, right? Whereas with the hydrogen inhalation device, you're basically turning droplets of distilled water into a gas. So now you have H2O, which is now a gas. So now you have H2 and O2. And it's capturing the H2 and driving it in through the tubing into your nose. And so you're literally going through droplets of water as fuel to make the hydrogen. And, a gallon of water would last about a month and a half, typically.
Yeah. Dr. G, question for you. Can somebody be on this too long?
Your body would just stop absorbing it. But maybe if they live in Vilcabamba, Ecuador, but then they don't have electricity. I mean, if you're going to live in the miracle of the 21st century and take a bath in Wi-Fi, Bluetooth, fluorinated water, get a vaccine, take an antibiotic, eat at, Burger King. I mean, you're in a state of constant degradation. You're in a state of chronic inflammation. And if the chronic inflammation is bad enough, you're going to throw your body into fight or flight, which is going to arrest your body's ability to digest food. It's going to arrest your body's ability to activate the immune system. And it's going to put all work orders for current connective tissue damage on hold until it goes from fight or flight back into rest and recover, right? So I think that it's almost silly to think that you can overdose on it, because it is an essential nutrient. And I want to take a second to tell the audience the difference between a nutrient and essential nutrient. Is a nutrient is a food that we're going to eat that is going to be eventually converted into glucose or fat for the Krebs cycle or the mitochondria to turn into ATP. An essential nutrient is going to be a nutrient that's found in our environment that our bodies cannot create. And if we don't have it, a cascade of biochemical reactions will not take place, which will lead to physiologic dysfunction. A simple example is vitamin C. We cannot create vitamin C. Bears create vitamin C in their liver. That's why they heal like Wolverine, right? But we can't create it. We can't create vitamin C if we don't get vitamin C from an exterior source. If we go on long enough, we end up looking like an extra on Pirates of the Caribbean because we get scurvy. We're falling apart at the seams, right? Our teeth's falling out, our hair is falling out, our skin is wrinkly and dry and ugly. And so an essential nutrient is a nutrient that is designed to be in the body. There's 90 of them. 65 of them are minerals, a bunch of amino acids, and some essential fatty acids. And then of those, molecular hydrogen is one. And the question then that I usually get from most patients is, well, if the cavemen needed molecular hydrogen, they didn't have electricity, well, where did they get it? A great question, Mr. Patient. The reality is that back when man was designed, there were these things called raw organic fruits and vegetables growing in mineral-dense soil in an unpolluted atmosphere. And when we would ingest these raw organic fruits and vegetables, the fiber from it would interact with our unpolluted, perfectly functioning microbiome that has never been devastated by a vaccine or an antibiotic or MSG. And the byproduct of the interaction between the fiber of those plant-based products and our microbiome created clouds and clouds and clouds of bioavailable molecular hydrogen 24/7. Well, listen, man, I don't eat a vegetable unless I'm forced to because I like meat. You know what I mean? So even if I went to Whole Foods and I got raw organic fruits and vegetables, I've been exposed to the sins of our past, Pop-Tarts and Tang from the 20th century. My microbiome is the average microbiome, so it's not going to create the level of molecular hydrogen necessary. Most of us are so deep in our own end zone that your body is literally starving for a lot of these essential nutrients. So, I think it's just a law of self-limiting returns because you sit there and you do it. I do it when I'm working out because I have a home gym. I occasionally tape it to my face because I mouth tape and I'll breathe it at night. I just haven't seen a case where you could get too much at the flow rate that the machines are calibrated for.
And also, you would also say that there's no contraindications for anybody to do it.
There isn't a contraindication for an essential nutrient.
Or age restriction, right? I have my 15-year-old daughter doing this for her chronic sinusitis. So I'm hoping this will really be a good solution for her chronic sinusitis.
Yeah. Sorry, Mick, you were going to add?
One of the things that you want to keep in mind is that, it works for the whole range of people that can benefit. People that are into wellness 2 to 3 times a week for 30 minutes each time is ample amount of time. People, because it has a residual effect of about 72 hours each time you do a session. So if it's in a med spa setting, if you will, then it works great for wellness patients. Now, when patients have issues with their health, from metabolic to different diseases, depending on the grade of their condition, we have a protocol whereby such like grade 1 would be 1 hour twice a day, every day or every other day at least, or 2 hour. Grade 2 would be 2 hours twice a day. Grade 3 would be 3 hours twice a day. Grade 4 would be somebody that's terminal or really suffering from a severe condition or recovering from a major surgery or whatnot. They would be doing it 4 hours twice a day. And the reason why is that in just 1 hour, you're saturating 36 trillion cells in your body from your head to your toe with the hydrogen. But each of those cells have 100 to 1,000 mitochondria. Now, each of those mitochondria have that electron transport chain that Dr. Greg alluded to that generates the ATP. And they, in turn, need plenty of hydrogen. So if you multiply the 36 trillion by 100 or 1,000, you can just imagine how much time you can actually spend with hydrogen where it won't overdo it for saturating your cells in mitochondria.
So I have a skin and beauty question for us midlife women that are looking for me. No, I mean, you're so beautiful. You don't need anything. So could I take the hydrogenated water from the probe, hydrogenate my glass, and then put it on my face?
Yeah, we actually have a device that reverses wrinkles and regenerates all the cells in your face. It's called Look 25. We sell it in Bloomingdale's and several other stores around the world. And basically what it is basically it looks like a large lipstick case. And you basically pour distilled water in it. And it turns that distilled water into hydrogen water just in a matter of, instantaneously, actually. And so when it sprays on the face, the hydrogen molecules start regenerating the epithelial skin cells, and it goes deep into the dermal skin layers because it is the smallest molecule in the universe, and then starts supercharging the fibroblasts in the dermal layers of skin to produce more collagen and elastin. So if you went to our website, look25.com, you'll see a slider there. That's one of our staff, actually, that in just 3 weeks with our special we have a special patented serum made up of hydrogen, but this special serum, we have a patent on how it's made so that it actually makes hydrogen in water and never dissipates, meaning it lasts forever. And so that's a very unique technology in the world. We even use it for wound care. But that particular device generates the hydrogen that you would otherwise be using in here. So if you did not want to use that Look 25 device, you can buy one of those inexpensive atomizers on Amazon for $10 and then put the distilled water hydrogenate some distilled water with our device and then just put it in there and start seeing your wrinkles disappear over a period of a few months.
That's crazy.
Yeah, I'm going to do that.
You need to be our lab specimen. Let's do it before and after. Guys, this is really good information. I know we've taken a lot of your time, so I really appreciate it. I do have one more question because in our previous episodes, we've talked a lot about regenerative medicine and peptides and things like that. I mean, I guess one of the questions I have is for recovery, people that are, over 40, 50 years of age, very, very active at a high level. They're in the world of peptides for regeneration or just trying to get an edge. This seems like such an awesome adjunct to everything that people do with peptides to continue to be able to stay active and not have those aches and pains. I think we've already answered that question, but is there anything you want to add to that category of people that are listening or watching?
Let me take this one, Mick. So,
Sure.
I'm 60, okay, and I do resistance training, and I do Mike Menser, to failure, right? And if I do that, I'm at the end of my workout, I'm lying on the floor for 45 minutes trying to recover. But if I do molecular hydrogen while I'm lifting, I do not have that massive need for recovery time. And if I'm doing cardio with molecular hydrogen, I almost never get tired. And if you really want to, like, if you're into working out and you want to see a difference, do like bench or upper body on Monday, and then you wouldn't do it the next day. But do bench the next day, but breathe molecular hydrogen for 30 minutes before you do that same exact workout. And prepare to be amazed at how you're able to do it like you did not just work out the day before.
That's amazing. That's
awesome.
great.
Brother, this is unbelievable. Unbelievable.
Yeah, that's great.
Is there anything else? What are you guys working on next? I know you're
Yeah, Mick,
so
you said something
innovative.
cool before we got on. Can you share that with our listeners?
Yeah, so one of my colleagues, he patented a new generation of stem cell technology that is unbelievable. And we've never seen anything like this. We've been integrating it into our practice for the last 4 months, and it's just astounding what kind of results we're getting. Basically, it's a technology that uses the actual signaling power of the stem cells, which is primarily what stem cells are used for when you inject them into the body. And when you inject stem cells in the body, the stem cells essentially tell the rest of your cells, because you know very well that you have plenty of stem cells already in your body. They're just sitting around doing nothing, like workers at a job site just sitting around waiting for their boss to show up. Well, once the boss shows up, which is the stem cells, they put out these signals which tell the cells what to do. And that signaling has been limited to just one area of the placental tissue up until now. People have heard of umbilical cord, mesenchymal stem cells. You've heard of exosomes coming from the umbilical cord. Some of you might have heard of Wharton's jelly. You may not know it, but you'll know it now. There are actually 6 areas of the placenta, and which most of them are not even being used in regenerative medicine today until now. You have the umbilical cord, you have the Wharton's jelly, you also have the amnion, the chorion, the villus placenta, and the decidua. Each of those areas have their own unique stem cells, and the combination of those 6 areas of the placenta is responsible for taking a baby turning baby into a human being in a period of just 9 months. And when you only have one part of that blueprint or one part of the signaling, you're not getting the full healing that you would want to get otherwise, that we're now able to get with this particular stem cell technology. And it comes in a form just like a peptide, so that you can actually administer just with a diabetic needle at home, just by administering it sub-Q, just like a GLP-1, or injecting it directly into the joint. And that particular product is called Ultra RSF, which is Ultra Regenerative Signaling Factors. And there's more information on our website, lifeforcelab.com, LIFEFORCELAB.com. So it's exponentially more powerful than stem cells with the simplicity of a peptide.
That's amazing.
Wow.
We'll have a link on our show notes for that information. And also we'll have a link on, if anybody's interested in exploring Hydro Heal more or purchasing one, there's a link on our website and whatnot.
We also have a discount link as well.
Okay.
That'll give anyone that wants to purchase this machine $600 off. So that'll be on our show notes as well.
Guys, thank you so much. First of all, we appreciate your time. I know we're going to see you guys in a few weeks or so in Florida at our next conference, but you guys were our first in-person, virtual guests on our podcast, and I really appreciate you guys and very grateful for what you're doing in this world of molecular hydrogen therapy. So thank you so much.
Thank you so much for joining us. And if there's any last comment you want to give our listeners, last words, please do it now.
I think aging's a mistake, and I don't want to participate and neither should you.
There you go. That's great.
I love that. I love that.
Great.
Thank you guys. Thanks for joining
guys.
us.
We'll talk to you soon.
Thank you.
That was pretty cool.
That was awesome.
That was really, really good.
I love this machine. I'm going to be curious to see how it works for Sid and her chronic sinusitis.
I think that's a good thing because you get, teenage athletes that, whether it's sinuses or let's say they get concussed playing sports or let's say they're more sore
Asthma,
after anything like that. I mean, I was trying to, and I kind of knew the answer. I don't know all the research like these guys do. I mean, these guys are the leaders in this,
Right.
but there really isn't a condition or a person that this can benefit.
No, this is complete. This
and
is
it's so simple.
This is the key root cause to solution to all root cause.
Yeah. So we've talked a lot
diseases.
about inflammation with like different episodes. We've talked about all the different things of inflammation, whether it's, I don't know, whatever we've talked about. And this is one very, very simple thing. I think a lot of times when people are going to invest their time or money into something, when it's difficult to do, they're less likely to do it.
Well,
this is like, we've sat here for, I don't even know how long we've sat here for. And it's simple to do, and you don't have to do as long as we've done it. And it clearly doesn't take a lot of space. When you set this up, what do you have to do besides
Nothing. You plug it in. Well, the only thing is you do have to use distilled water.
Okay, that's what I was going to say. That's
go
why
to
you
the
got to go
store,
buy distilled water jugs.
Which is actually really cheap.
Yeah.
It's
and
like
then how much
$1 a
distilled
gallon.
water? How much
So
does
you
it?
fill it up halfway here, and then that's really it. And then every now and then you'll see these side tanks kind of get filled with some. It's a
I see that right
humidifier
here.
side tank. You just have to empty those, and that's it.
Got
There's
it.
really no. The only consumable is the distilled water, which is very inexpensive. And then
the
just
cannulas.
the cannulas, but they give you a ton.
Yeah.
And if it's just you using, like I have them labeled, so when Sydney uses them, when I use it, I use my own. So it's not like, I'm throwing them away each time.
Yeah, just reuse them.
Yeah.
We saw these guys. Well, you saw them once a year ago at a conference, and then we saw them again a few months ago at another conference, and just learn more about what they're doing and talk to other physicians that have been utilizing this in their clinics as an adjunct to either IV therapy or a lot of people end up getting it for home because it's not.
Well, and what's interesting is when people do this during IV therapy in clinic, the rate that you actually absorb the IV is much higher. Yeah.
One of the things in researching before this meeting with them for me was the fact that selective antioxidant, it's a selective antioxidant, which was we've all heard of antioxidants, but the fact that these hydrogen molecules, I kind of visualize them. They literally go through, because they're so small, and they go find those free radicals that really need to be deteriorated and worked on.
Well, and going back to senescent cells, right? Zombie cells. I like to use big words because he's not really privy to big words.
I don't know. She doesn't know how to spell it. Yeah.
So these senescent cells are the cells that are basically dead cells that circulate in your body that are no longer in use. And that's why intermittent fasting is so good to get rid of these senescent cells. But if you aren't fasting on a regular basis, or you can't, or for whatever reason, your cell turnover is just not keeping up with, getting rid of the zombie cells, this machine will help release all those zombie cells, those senescent cells, and
really
kind of
good.
deplete your.
So
your
you
system.
said earlier that there'll be a link on our bio. We have information. You guys go to their website, do your research, Google molecular hydrogen. Don't even put a hydro heal. Just Google
molecular hydrogen.
Hydrogen, whatever condition you or a family member or loved one is suffering from. And then we have a discount code, so you can use that and set it up in your home, and let us know if you have questions. This was awesome.
Yeah, it was great.
Fun.
And
so much more fun than just talking to you the whole time. I mean,
why are you
way
so
more
mean?
fun.
You know, I think that you secretly like to hang out with me, though.
No,
because
I don't. Justin pays me to hang out with you. So. And by the way, I'm getting a lot of tequila smell right now. Is that normal?
I laced your too. I laced yours with some special
Mine
stuff.
smells like tequila. No, kidding. That was awesome. You want to wrap it up?
So thanks for listening, guys. Remember, we'll have a link to more information about this. We'll have the links that Mick and Dr. G talked about in their segment and then section. And then we'll have our not affiliate link, but our discount link on there for you to use, and it gives you $600 off a machine. So, and one thing I will say, I have this by my TV. So when I'm just at the end of the day, we're just watching TV. We're just doing this. Like, it's so
Two
easy.
people at once, too.
Two
Like,
people at once, yeah.
which is pretty
It's so
cool,
easy. Yeah.
All right. Thanks for listening. Till next time.
All right. Bye, guys.
Bye. The information provided in this podcast is for educational and informational purposes only and is not intended as medical advice. While we may be licensed healthcare professionals, this content should not be used to diagnose or treat any medical condition or to replace the advice of your personal healthcare provider.
Always consult your doctor or a qualified health professional with any questions you may have regarding a medical condition. Listening to this podcast does not create a doctor-patient relationship. Reliance on any information provided is solely at your own risk.